Okay, you're on the air. What's your question, please? Hello.
Hello. Good evening.
Good evening.
How you doing? Hey. This is Robert Sykes. And hi, Gene.
Hey, Robert. How are you? You've got a question for Dr. Michael?
Not a question, but in the beginning of this, I listened to the explanations by both incredible doctors, and I'm just so amazed and overwhelmed at the time and effort they put into humanity. It's just overwhelming to hear this and to know that now I'm associated with Dr. Richard Michael for so many years. He's been my personal doctor for at least 30 years, maybe more. So when he moved into this program a couple of years ago, everybody had questions about how it would work and what it would be. And I just wanted to say to the audience listening tonight, I have now been in it. My wife and I both have been in the program for about 2 years. And I wanted to say, as they continue to explain this, I wanted the audience to hear in advance from somebody that's already been in it how important this has been in our lives. When we decided to make what I would call this investment, it was a little bit different. And then we came home and compared notes on the things that we did invest money in: home improvement, furniture, vehicles, other material things, entertainment. And we got thinking, going into our late 60s, the investment in our life is more important than anything. But we went into it, still wondering, how will this work? Well, I want to tell you, first of all, the attention that we get individually when we go is, you can't even explain it in a normal medical terms, because it's so expanded beyond what we normally receive. And it's almost impossible to do, as Richard talked about earlier. When you have that many patients and that much time in a day, you just can't get this. But we knew as we got older, this was going to be the most important thing that we could invest our money in and our time as well. I have learned things about my health, and I think I'm a pretty healthy person, and I have been, fortunately. But these tests and this time that Richard Michael has put into my life since I joined this has led me into some areas that I was not aware of, that I had some issues with. Not anything drastic, but catching them in advance, cholesterol and plaque and things like that. I'm a guy that goes to the YMCA every day of my life for 40 years, and I'm healthy, I'm good in my mind. But I realize with family history and other issues that doesn't always mean it's a guarantee. So we started myself on a program recently that will avoid some of these things going forward for me. And he's done the same thing for my wife, Janet. And the attention and the expertise that we receive with his staff and with him, but it goes beyond the medical side of it. When we sit down for our physical, which sometimes lasts 2 hours, I want to remind everybody in the audience tonight, it's not 30 minutes, it's 2 hours. If I want it to be an hour or an hour and a half or two, that's totally up to me. The questions and answers don't stop until I'm ready. It's about my life, my job, my stress, my faith, my sleep. And then we've had programs that he's provided with dietitians and other experts that he's brought in from Duke that we would not have received otherwise. But it's just a wonderful way to find out what is going on with your life and your health, well beyond what anything I could have ever imagined. So I've got somebody that's an advocate for me, and Dr. Michael. This program is something that I would highly recommend. And as y'all continue to describe this, you will learn more about it. But I wanted to get ahead of that and tell you how good it is. Thank you for your time.
Robert, thank you. That sounds wonderful.